everyone, today I'm going to be talking with Dr. Sanne van Rooij, a leading researcher on PTSD and trauma recovery. We will be discussing what PTSD is, who it affects, and how to recover. So if any of that sounds interesting to you, please keep listening. Is there anything you'd like to add, Dr. van Rooij?
No, that sounds great.
Okay, perfect. So my first question is, what is PTSD and how does it differ from quote-unquote regular trauma?
Yeah, that's a great question. I think trauma actually probably deserves a little bit of an explanation. I know we use trauma for a lot of things. Something that's unpleasant is oftentimes called a trauma. For PTSD, post-traumatic stress disorder, a trauma has to meet a certain criteria. We call it a criterion A trauma. And it has to be something that you experience that either can lead to a risk of death or witnessing death. It can lead to possible injury or actual injury and or sexual violence, either threat of sexual violence or experiencing or learning about it. So it has to be one of those aspects to really meet the criterion A for trauma. And then the difference between just experiencing trauma, because most people will experience a trauma in their life. Like most people will either experience a severe car accident that could have led to serious injury or learn about an unexpected sudden death that can be really traumatic. But in order to develop PTSD, post-traumatic stress disorder, you have to have symptoms that really follow the experience of this traumatic event. So where most people who've just been in a car accident, for example, the first time they get behind the wheel, they're still a little nervous and afraid that they will actually experience a car accident again, or they're just a little, nervous to get behind the wheel, something may happen. Soon enough, if you've been doing that a couple of times, you can probably tell that the next time and, the following times you're doing better. This is different from individuals who develop PTSD. It actually gets worse. Like the next time they're even more nervous to get behind the wheel, and they're not just afraid of getting in the car. You may get afraid of just getting on the road in general, or like even riding with someone else. And maybe you start like thinking about the car accident at times, even when you're just in your room and just like, sitting or something, you hear something that kind of reminds you of the sound of the car accident. And then you like start thinking about it, and it may affect your sleep. You may have nightmares about it or have difficulty concentrating. So all of those symptoms that follow a traumatic event are part of a post-traumatic stress disorder.
So why do you think two people might experience the same trauma, like the same car accident, but one person will develop PTSD and one person won't?
Well, that's a really good question. And that's one of the main questions we're trying to answer in research at the moment. And we have a couple of ideas why that can be the case, but we don't know exactly. One reason we know is if you've had a lot of trauma earlier in your life, you're more likely to actually experience symptoms after a following trauma. So basically, the more you've experienced, the greater the chances that this one, if the previous ones haven't affected you, that this one will affect you, and especially early trauma. So really, during childhood, if you grow up in an unstable household where either there's like abuse or maybe neglect or even just a lot of stress, that can really impact your risk of developing a trauma later in life even. My research really focuses on neurobiology. So we use neuroimaging, so MRI scans, to see if we can find like brain regions that may explain why some people are more at risk for developing PTSD and others are not. So we have some ideas about a brain region, the amygdala, which really responds strongly to anything emotional and mostly very like something threatening will really activate the amygdala. We know that individuals who have greater amygdala reactivity when something is threatening are at greater risk of developing PTSD. So if you just respond more strongly emotionally, then you're more likely at risk to develop PTSD. It doesn't mean that you're a more emotional person that will lead to that, but we measure it with neuroimaging.
Does that mean that you could theoretically treat PTSD by influencing the amygdala?
Oh, I almost could have like whispered this question to you because this is exactly something we're currently working on. We hope so, but we don't know. So the current treatments for PTSD are really focusing on the trauma and like talk therapy. So as I said, like some people just get behind the wheel after they've had a car accident and like kind of learn that it's safe. And people who develop PTSD may need some help with that. So instead of like just going behind the wheel immediately, they talk to a therapist, and the therapist will like go back to the car accident and like have them talk about it in a safe environment. And they sort of like, as we call it, extinguish during the therapy. So the next time they talk about it, maybe the first time they talk about it with the therapist, they have like really high physical and emotional responses, but then sort of like the more they talk about it, the less strong those responses become. And that is a very effective therapy for PTSD. So that's the main therapy. However, we know that in the prior research, some of the research I've done, but also others have shown that if you have this greater amygdala reactivity, not only are you at greater risk of developing PTSD, you're also at greater risk of not responding to this treatment. So basically, when you're with the therapist, your amygdala is so active and like everything that's even a little bit threatening, you're just like thinking about that the whole time. And so it's really hard to learn from the safe environment that you're in and like benefit from your sessions with the therapist. So for that reason, as you suggested, we are now looking at if we can sort of dampen the amygdala and see if that helps, especially for individuals who are not able to do the talk therapy, but maybe also in general, if this can like help people to do better. And so we've seen in patients who have epilepsy, who also had PTSD, they were treated at Emory, and just on one side, the right amygdala, was ablated to treat their epilepsy. And then we saw that they actually did better in PTSD as well. So they did not have PTSD symptoms after the amygdala was ablated. Obviously, there's a lot of limitations to doing surgery for everyone. And if you can avoid that, you, of course, like I'm at least as a non-surgeon, like to see if there's another way that we can dampen this amygdala. So what we're currently doing is we use magnetic stimulation. It's like called transcranial magnetic stimulation. So it's basically a magnet that we place on the head, and that can either activate some neurons or it can downrate, like dampen, inhibit some neurons. The amygdala is kind of deep in the brain, so we cannot use this stimulation to get to the amygdala. So what we do instead is we find where the amygdala is with an MRI scan, and then we find an area more like on the surface of the brain on the right side and see which part is talking to the amygdala. So there's like a way to analyze how brain regions are communicating. It's called functional connectivity. So they're functionally connected. And so we look at if the amygdala is, let's say, really active, this region is also really active. And if the amygdala is kind of calm, this region is also kind of calm. So we find that area on the head, actually, that is communicating with the amygdala. And that's where we place the stimulation. And that's what we're currently testing to see if this is working as a treatment for PTSD. So we're hoping that we can lower the activation in the amygdala as a way to help people with their symptoms.
Oh, that's really fascinating. Because, like, I know this is, like, a pattern with a lot of mental issues where therapy and talk therapy, things like systematic desensitization, CBT, it works for a lot of people, but not everyone. And,
exactly.
Like, it's so hard to find even, like, medication that works for you. Because there's so many different options, and, like, everyone has, like, kind of different biological mechanisms behind their symptoms. So if this works for people who aren't responding to talk therapy, I think it could make a really big difference.
Yeah, we hope so. There's definitely like prior studies that have done this that have showed like it works, but we are really looking at the connection with the amygdala as a new way and really seeing if we stimulate, if we also see like lower activation in the amygdala. So hopefully this will really give us a lot of information if this is a possible new treatment. Yeah.
Yeah, that's very fascinating. Do you see any patterns in, like, the type of people who have PTSD? Like, we often think it's only veterans, but are there other groups of people who are at higher risk than the general population?
Yeah, that's a great question too. I think you raise a really good point. I think maybe 20, 30 years ago, veterans and maybe survivors from sexual trauma were like in research studies. But what we've been learning in the past 20 years is like anyone can develop PTSD because anyone can can experience a trauma. So that's exactly why I brought up the example of a car accident. Anyone can experience a car accident, and it can just be something that really haunts you for a long time. So we know that veterans experience a lot of trauma, and that's why, there's probably like higher proportion of veterans that have PTSD than the general population, simply because they have experienced so many events. And as I mentioned, like the more you have experienced, the greater the chances that you develop at some point PTSD. The Grady Trauma Project here, based out of Atlanta, where we study individuals who experience a lot of trauma in their daily lives, living in low-resourced communities where there's a lot of exposure to different traumatic experiences, where there's experiencing a lot of racism, which we know is a chronic severe stressor and possibly traumatic stressor too. We know there's a lot of really high levels of PTSD in that community too. And it's actually what we've seen with the Grady Trauma Project is that in our studies, 46% have met for PTSD at some point in their lives, which is compared to 6 to 8% of the general population, about 31% in veterans. So you can see that if you experience a lot of trauma and grow up in an environment with low resources and high levels of trauma exposure, you're at risk, basically.
That's a huge gap, like less than 10% to over 40.
Yeah.
Yeah.
I don't think it's unique to, this specific area in Atlanta. I think for a long time, symptoms of PTSD have not really been recognized. So it was maybe seen as, measured as depression, or just something that was normal, or people didn't really know that was, what they were experiencing was actually related to the traumas they've experienced. And that's one thing that the Grady Trauma Project has really contributed to, is this understanding that their trauma can be very prevalent in civilian communities as well, and like urban communities. And it's not just a disorder that is seen in veterans.
Yeah, that reminds me of some things I'm learning about in my sociology class right now, where it's like people in low-income neighborhoods and people of color in the US, their lifespans are way shorter than like people from high-income neighborhoods. And I think that shows that it's not just like poverty, because obviously that plays a role, but also like racism and excluding people from the rest of society. People often think of racism as like, oh, sticks and stones can break my bones, but words can never hurt me. Like, who cares if people have like microaggressions towards you? But I think more and more research is showing it really affects people's physical health, from from PTSD and like depression and drug use to like issues with lungs and like heart diseases. So yeah, I think it's really great that we're finally doing research on civilian PTSD and showing how socioeconomic gaps and racial disparities also play a role.
Yeah, you're making really excellent points. And I think it's also exactly what you are bringing up. Your first question, like trauma and PTSD are not the same thing, but PTSD is one of the consequences of trauma. But experiencing trauma can impact so many other things like you were bringing up. So yes, depression and like greater risk for substance use, but also cardiovascular disease and so many other like physical symptoms. Yeah.
Yeah. What factors do you think make someone more or less likely to recover from PTSD?
That is also something we don't know too much about. We think a lot of the factors that help you like prevent the development also help you with recovery. You can develop PTSD from one trauma, of course, and the chances that you improve are greater than someone who's had a long history of trauma with very complicated childhood traumas in addition to that, which is, again, like you're at greater risk of developing it and you're at greater risk of not recovering or sort of persistence of symptoms or chronicity. Similarly, for like some brain markers that we've identified, like a lower hippocampal volume, so a region that's very important for providing you with information about your environment and in your memory and where your trauma basically occurred. If you have lower volume of the hippocampus, you're not only at greater risk of developing PTSD, or it's seen in patients with PTSD, but it's also seen in those who don't recover from PTSD. So it's, again, like a similar risk. Same with the amygdala that we talked about. Like, greater activation is not only related to development, but also to not recovering from treatment. So it's kind of, yeah, it's like different questions, but also we don't know enough for specific reasons why, if they're different, or if it looks like they could be pretty overlapping, actually. Yeah.
Do you think there could be ways to influence the hippocampus to treat PTSD like you're doing for the amygdala?
Yeah, we don't know about this same approach. It's maybe something for the future, but there are some very interesting studies showing that things like exercise are really beneficial for the hippocampus, which is, great option for, it's healthy in any case, but if it's also like really beneficial for biological risk factors, I think that's great. And like mindfulness, it's also something that is used to mitigate some effects of trauma, or just as a treatment for trauma. Yeah, especially for individuals who are not able to tolerate the trauma-focused talk therapies. This could be really good options to do something, basically, and it could be very, very beneficial.
Yeah, exercise and mindfulness seem to come up in like every kind of mental illness I've learned about. And it seems to be so effective yet simple, which is why I think a lot of people are skeptical. Like how could something so simple as taking a walk once a day like improve my mental health when I'm like really suffering? But yeah, I think it's so good for prevention and treatment, and it's so easy that everyone should give those two things a shot. Even if they're skeptical, and like obviously no one thinks it's like a magic cure, but like I think it definitely makes a difference for the vast majority of people.
Yes, agreed. I mean, if you have very severe symptoms and you're not able to, you just are constantly haunted by these thoughts. Of course, like going for a walk every other day is not going to do the trick, or most likely not. But I think it benefits anyone to go outside and move and do any kind of exercise. So I think you're making a really good point. Like it's not a cure for anything and everything, but it's definitely good, and there's no downside to it. So
yeah, and I think with mindfulness too, the phrase has become so popular lately that it's starting to diverge a little bit into pseudoscience. Like there's some people who are misusing it, and that's causing a lot of confusion. But like I think the core of mindfulness, like being in the present and like practicing meditation or like yoga and other similar practices, are really good. So for anyone listening who's interested in mindfulness, like I would say don't get your information off of TikTok. Like go on the internet and read a little bit about it, because there is a lot of supporting actual scientific evidence.
yes,
Yeah.
exactly.
I read one of your papers, Rethinking Resilience Using the R Factor, and in that paper, you identify a common factor for resilience, which you call the R factor. Can you explain a little bit more about that?
Yes, it's a little complicated because kind of methodological, so I was very impressed you read it. It's a study, it's a large study that was conducted across the US, where individuals who were brought to the emergency room after most of them experienced a car accident, but also physical assault or sexual assault or a whole host of traumas were included. They were followed for the year following this trauma to see, can we identify who develops symptoms after trauma? And then we did an MRI scan 2 weeks after. So to really, in the early phase after experiencing this trauma, see if we can identify any markers in the brain that predict who's at risk. So what we've done in the past is really look at, can we predict who will develop PTSD? And so then the regions that we spoke about earlier, the amygdala and the hippocampus, came up as predictors. But then we know, as we also talked about, PTSD is just one of them, several outcomes and adverse outcomes from trauma. And so this study really looks at several different types of symptoms and including like PTSD symptoms, depression symptoms, anxiety symptoms. We looked at sleep, impulsivity. I may even forget one. So instead of just looking at, can we predict who is developing symptoms, we're looking, okay, can we predict who is doing well across all of these different domains, as we call them, who is doing well? Like, can we predict mental well-being? So we looked across all of the potential outcomes, potential symptoms, and then created this one factor. So it's just basically everyone got a score on the R factor value. And so if you had a higher score, it means that you're doing well in your mental well-being at 6 months after trauma as well. And then if you have a low score, it means that you're not doing well. You have like symptoms across the board, basically. Because a lot of these symptoms go hand in hand. If you have PTSD symptoms, you likely also have a lot of people also have some depression symptoms. So that's what we looked at. So we looked at overall mental well-being at 6 months, and then we looked both at how that is at 6 months. And if we see people who may have some symptoms at 2 weeks who are doing better or worse at 6 months. So we call that like a static R factor, how they're doing at 6 months, and then dynamic, how they're kind of like changing from 2 weeks to 6 months. But let's just focus on the static one. So then we looked at brain responses during when we showed them fearful faces. So can we show some threatening stimuli, see how the brain responds to those. And we showed like rewarding stimuli, so things that are pleasant. Basically, in this case, they could win some money. So that's like really pleasant. And we looked at another measure, but inhibition, but we can ignore that. So what we saw is that individuals who basically paid more attention to the rewarding stimuli and less attention to the threatening stimuli were the ones that were doing better. So basically, paying attention to reward, to something positive after trauma, could be an indicator of doing better 6 months later, which is kind of in line with some studies that show you can do like a positive bias training to like positive stimuli, and that was really a beneficial treatment for individuals. So this study is not so much conclusive, but more suggesting that we should think along the lines of like paying attention to rewards and pleasant stimuli as a potential way to improve resilience.
That's really interesting. And that could also suggest why some people might be more susceptible not to recover. Because, yeah. I mean, I'm just thinking here, if you are like from a disadvantaged neighborhood or socioeconomic status, you might feel like you don't have much to look forward to. Like there isn't like an exciting job promotion or like vacation or anything coming up. So that might be another factor that makes it harder for some people to recover.
Yeah, exactly. And the flip side too, like you may be more so-called wired to pay attention to anything threatening because that's how you grew up. And we've seen this in our earlier studies with children, is that like those who are exposed to more violence, we see changes in their brain that they're more attuned to anything potentially threatening if they have experienced more violence. So this can be beneficial, when you grow up in an environment with a lot of violence. It's probably going to help you not, get into any, terrible situations if you can see what's happening and sort of like pay attention to it. But in the long run, we don't know what the outcomes are and how it puts you at risk. So we're still like trying to understand that. But that's one of the outstanding questions.
Yeah, and that's probably why childhood experiences can affect you later in life, because you have that like hypervigilance going on.
Yeah, that's what we think. Yeah.
So I was wondering, how can parents recognize signs of trauma or PTSD in their teenagers?
Yes, that's important. Signs of trauma itself will be difficult, right? It's like if someone doesn't share what they've experienced, it's hard to detect trauma itself. I think what some of the main symptoms of PTSD, so if you experience trauma and it's really bothering you to a point that it's like, really impacting you, there could be signs of avoiding things that could remind you of the trauma. So maybe not going out, or maybe not if you always used to walk somewhere, maybe not wanting to do that anymore and only want to drive, or vice versa, or problems with concentration, possibly like being more on edge, like something easily startles someone. It can be a sign of PTSD, like potential sleep problems, even also some risk-taking behavior. So kind of impulsive behavior is also a sign of PTSD. So I think if those symptoms arise, if people don't do things that they used to, are kind of indicators that there may be trauma, and especially if they seem to link up to something or kind of like converge. Yeah.
Yeah, I think like most psychiatric illnesses, any sudden change in behavior would be a red flag.
Yeah, sudden or even gradual, because sometimes with PTSD doesn't have to be from, like you can start experience or start thinking and then start avoiding, and it just can get sort of worse over time. So it's if it's sudden for sure, but even if it's not sudden, but just sort of slowly, you're slowly not getting out of that situation where you just, because here's what happens. Like if you have these thoughts and then you start avoiding, and then, like you start, it's just kind of becomes like a negative spiral that it's harder to get out of at some point.
Yeah, and I think because it has that spiraling nature, it's probably really important to intervene early on. Because the
That's
later you wait, the deeper you are in that spiral, the harder it's gonna be.
Yeah, and people sometimes like change their life around. It's possible to avoid things, and you just like you think like, no, it's fine. People just, instead of going the straight to where they have to go, maybe they take like a 15-minute detour such that they will not like, you know, go to that certain intersection, and they're like, no, it's fine, it doesn't impact my life. But when they think about it, they actually have adapted to the symptoms and sort of avoid, but not even recognize that they're avoiding it. So those kind of things really become part of someone's life in a way that, can be really hard.
Yeah, that kind of reminds me of like OCD. Like a lot of people will adapt and they'll be like, oh, like what's the big deal if I need to check the lock to my door 3 times every single day before leaving? What's the big deal? It's just like 10 minutes going. But all of those things will start piling up, and 10 minutes will turn into 30 minutes, will turn into an hour. So, yeah, it's really important to intervene early on if possible.
Yeah. Yeah, absolutely. If there's resources and hopefully people out there in communities that can help.
So, for parents who are trying to support their children or the teenagers who have been diagnosed with PTSD and they're getting treatment, how can parents be supportive of that treatment and that recovery process? What are like the do's and don'ts?
Oh, let me think about that. So that's hard to say, as I'm not a clinician, so I don't want to suggest things that are not going to be helpful in the end. I think it's really, I would say, collaboration with the clinician in this regard.
I think it's a really good point to collaborate like with the clinicians and create like a support team rather than a bunch of different people like
Yeah.
giving conflicting advice, or because
Yeah.
the clinician usually knows what's best, but the parents also know a lot about the child, and the parents also have a unique ability to implement what the clinician says at home. So if both
Yeah.
parties work together, I think that would be the most effective.
Yes, I agree.
And are there any common misconceptions about PTSD, either about like the diagnosis or the treatment or the illness itself?
I think you brought them up early on. Like, it's not just in veterans. Trauma is not the same as PTSD. So we really talked about those things, like what sets it apart. It can happen to anyone. And I think those are kind of unknowns to a lot of people. Like, I know, being diagnosed with PTSD may not, for everyone make sense initially, but it's really everyone can experience trauma, and it can impact and affect anyone. And thankfully, that treatments that we have are really effective for 50 to 70% of people. And then there's a lot of research trying to help those other almost 30 to 50%, unfortunately. But yeah, hopefully there will be more options available. So I think you raised like really the main misconceptions there are about PTSD.
Those are all the questions I had today. If any of you listening have questions, please don't hesitate to email notanotherdepressedteen@gmail.com. I hope this episode answered some questions about PTSD, and as always, please don't hesitate to email us if you have any questions about anything mental health related. Thank you.